All right, and we're so grateful to have you, so take it away.
We're very grateful to be here. Thank you. I'd just like to start. I'm Gail. This is Judy. I would just like to start by asking you questions about your faith community. What's it like? What's the mental health community like here within your faith community and also within the community, the surrounding communities, 5, 10, 15 miles around? How would you describe it?
Do you mean the state of mental health or the support for mental health?
Kind of both.
Okay,
Yeah, just,
okay.
you know, what are you thinking about when you think about mental health in this area? One of the faith communities that we work with got involved initially because there were so many suicides in the area. So there are, you know, different things going on in different parts of the city. So what would you say about Bloomington, your faith community?
I will say that Kennedy High School, which is just right down here, has noticed a change in their students since the pandemic. There's a lot more kids not coming to school, a lot more sort of issues that are mental health based, and of course mental health which stems from insecure economics and other things like that. So they're really working hard as an administration to try to figure out how to help kids, because a lot of them are struggling.
Right. And are you involved at all with the schools, or?
A little bit. One of the things that we do once a year is we raise funds and donations to what they call the pantry, which kids can go to and get items that they need that they may not be able to afford and that may not be accessible in other places. Yeah.
So when we've been out talking to other faith communities, what we found is the two main areas for concern: youth mental health and loneliness. So kind of and loneliness can be at any age, but that has those are the two main areas. You're shaking your head. Would you kind of agree that?
Yeah, I work in a high school in St. Paul, and we have seen a huge increase in mental health issues, and they're trying to get more and more support, but there's a lack of mental health providers for sure. And then just having kids going through the school system, like, you know, I don't remember anyone I knew as a kid that had anxiety or, you know, I mean, you maybe one or two people, but I mean, they come home and all their friends are struggling, you know, so it's kind of like, it's everywhere, yeah.
Yeah, there was a program on NPR, I think it was either yesterday or the day before, I was listening to, where they were talking to school principals, and they said how they're having such a difficult time even doing their jobs because there's so much mental health issues with the students that they're having to deal with.
Yeah.
So,
there's also an article in the paper today about state funding and what the legislature is doing or not doing in terms of supporting mental health programs. So that's something we all need to be aware of in terms of contacting our representatives, because there's something that's going to happen in 2025, I think.
Yeah, I was going to say also, I also work for NAMI Hennepin County, and there used to only be 2 of us on the board for a number of years. Now business is really booming. Like, there's a lot of people interested in it right now.
Do you want to tell us what NAMI is? I don't think everyone knows.
National Alliance for Mental Illness, and it's not church oriented. This is more like church community oriented. This is more of a it's like a government or a state alliance on trying to help people with mental illness. It's very much like this, except it's more how you might say, it's not church focused, you know.
And NAMI is fabulous. I rely on NAMI a lot as a navigator. They have courses online and in person and education resources, peer-to-peer support groups, other support groups. along certain different needs. So they do fabulous work, really great.
So just a couple or a few statistics that I think are interesting, and these might even be conservative actually, but it's estimated that 1 out of 4 adults suffer from a diagnosable mental disorder annually. So that's 1 out of 4 adults, which also means that's 1 out of 4 adults within your faith community. So nearly half of us will experience mental illness in our lifetime. And the Forbes article came out, they surveyed 2,000 adults and found that nearly half of them across generational divides believe it's important to look after mental health. And I think 5 years ago, 10 years ago, if you did that survey, people would go, huh? What do you mean my mental health? I'm kind of worried about my physical health, but not thinking about it. So it's becoming at least more talked about and more realistic. Some other interesting statistics that that I'm sure Pastor Siri can attest to, that over 60% of the people that have mental health concerns will go to their pastor first. That's where they go for help. And that's where mental health comes in terms of being a support to pastors, because pastors aren't necessarily equipped to deal with the issues that people bring to them. I know, however, that our pastor, who lost his daughter to suicide several years ago, says a lot of times people will come to him because they think that he's, he understands, it's easy to talk to, but when he suggests they go any further, they won't go any further. They don't want to talk to anyone else. So I don't know if you experience some of that also, that they're comfortable with you, but then you say, well, how about, The other thing is 56% of pastors strongly agree that local churches have a responsibility to support individuals. And I really like that we're understanding that faith communities are part of the healing process. It certainly hasn't always been that way. But on the other hand, 49% of pastors say they rarely speak about mental health in their faith communities. So they're on the one hand saying that the churches do have a responsibility. On the other side, they're saying, but we really don't talk about it. And 35%, if you can believe it, of Americans still say that if you read the Bible more and pray more, that your mental health issues will be resolved. And if you go online and just start reading some of this, it's pretty unbelievable. So I think you can understand that we really do, as the faith communities, have some responsibility as it relates to mental health, and that's what Mental Health Connect is about. We have a couple ambassadors to Mental Health Connect sitting right over there. We're very happy to have them. They come to meetings, and we'll talk more about how that works in a few minutes. But Judy, do you want to talk about Mental Health Connect a little bit?
So, pages aren't numbered, but we're on your
Yeah, it says page 6, but I put them in the wrong.
Oh, I'm in the middle of cataract surgery, so I can't really see. Oh yeah, there's a page number. Okay. Our purpose, and as Gail said, and we're celebrating our 10th anniversary this year, which is fabulous, and there's been a lot of growth and changes over the years. I've been with Mental Health Connect about 1.5 years, and Gail's been around longer.
2018.
So she's one of the pillars, she won't say that, but of the organization. So 37 faith communities, and there's a list at the end of your handout. Part of what we want to do is reduce the stigma of mental health. I'm not professionally trained, but I grew up in a household where my mother suffered from depression. She would go off to be hospitalized. She'd have shock treatment. She'd come back. She was medicated. So there was a lot of stigma with her trying to hide from the church people and from the neighborhood and the family what was going on. So it can be really devastating for families or anyone else if they don't recognize that it's legitimate to get help as well as for your physical health. mental health is equally as important. Part of navigation is helping individuals get to the right source of help, and we'll talk about more of that later. Page 7. There are educational monthly sessions for the ambassadors, and as a navigator, we meet weekly to have training and discuss cases that we're working on. And also the churches can have training like this or other specific training. I know, Gail, you've done a lot of training in the churches, depending on what needs the churches might identify.
The other thing I wanted to add about the monthly meetings for the ambassadors, all of you are invited to all the ambassador meetings. So the ambassadors will be letting you know, and it's opened up to everybody. So if there's a topic that you're interested in or just want to learn more, the topics really vary, and you're all invited to the ambassador meetings.
And I believe those are Tuesday nights. Are they twice a month?
They're once a month
Once a
from
month?
7 to 8:30. The fourth Tuesday? Is it the fourth Tuesday of the month?
Second Tuesday.
Second Tuesday of the
Tuesday?
month.
And you can join via Zoom online, correct?
Yes, they're all virtual and in person. So
So if somebody wanted to be on the contact list to get the email saying what's coming up, they could maybe give their email to me or to you,
yep,
correct?
Sure. Yep, and we can put it on, or the ambassadors can also take the names and let us know.
Perfect.
Where are these meetings held? They rotate around, or?
No, they're in Bloomington at the, in Minneapolis at Bethlehem Lutheran Church.
Oh.
It's on 41st and Lindale.
Okay. Any other comments or questions about the education and how that works into the program? Services provided. I'm a navigator, and I've done it, as I said, for 1.5 years, and we are trained to be empathic listeners and to work with people to gain their trust so that they open up and share what their needs are, and then help to connect them to appropriate resources. I might get a call about an 85-year-old woman who's just lost her husband and is looking for a grief support group. Or I might get a call from a mother whose child is binary and is having adverse treatment in their school setting, and what kind of help could we find? We get calls about homelessness, about I have a schizophrenic son, he won't take his meds, and what do I do with it? I had a call about an 8-year-old who's threatening her mother with a knife, and what can she do about it? So there are all kinds of situations, and people are under stress, and so they're looking for help and what to do next. So it's really an honor to try and be that conduit to getting appropriate help. And we're always looking for navigators, so if anyone's interested, we're available Monday through Friday, 9 through 5, and then one evening, Wednesday evening, once a month. Then if someone calls or emails over the weekend, we'll pick that up on Monday. So we're not a crisis line, we're what you call a warm line. So people wouldn't call us if they were feeling suicidal or if they didn't feel safe in the home, for instance. And sometimes it's just helping people to think through a crisis. Like, have you talked to your primary care doctor? Have you talked to your employer who might have a program? Have you talked to your minister? And then it's very practical. Do you have insurance? Do you want to see a person online or in person? Do you want to see a male or a female? Is there an age that's most appropriate? Have you had any counseling before? How did that work? Do you have a diagnosis? Are you on medication? Do you have transportation? What's your zip code? Because a lot of counties have services. Do you need to see someone right away? There's walk-in counseling. Do you need someone to come to your home? There's COPE. So there's all kinds of information that we need so that we can do our job in the best. And it's really a whole array of questions and comments. So do any of you, yes?
You mentioned you're not a crisis hotline, but a warm line. But I assume that you occasionally get such crisis calls. I assume, and you just simply refer to those calls to
I've
the
never had a
appropriate
crisis
lines?
call.
Okay.
And I don't know if anyone else has. We work as a team. So I might start working with someone on Tuesday and I'm doing the research, but there's more that needs to come. So then I'll tell them my colleague is going to follow up with you on Wednesday. And then we try to share our areas of expertise. That's what we do in our staff meetings every week. And then we do follow up with people the next week, or if they come back to us. So we like to develop a relationship that's ongoing, because you can't just tackle a question or a problem in one session. And we want people to know that we're there to follow up and kind of keep them on track if they're having trouble. It takes a lot of courage to make that first step, and then you want to be able to help people follow through. Yes?
That's also another interesting point about mental health. It's not like some mental health or physical health situations where you quick set a bone and then let it heal and it's done. Mental health is oftentimes like a chronic condition that needs to be cared for and kept at a healthy level.
Many calls about people who are calling for someone else. I'm calling for my brother-in-law. I think he has a problem, but he doesn't think he does. How do I talk to him? For instance. So people call for themselves, but then they also call for other people in their family or in their church or in their environment that need help. So it's a whole array of situations in the community. Did you have a question over
Yeah, I was
there?
just wondering what your caseload is. If you have ongoing relationships with various people, like how many people are you connected
So a
with
pretty
on
full
recurring-
day for me would be 3 or 4 people, because each call takes at least a couple hours, because we will call facilities to see if they're taking new patients, if they're taking this insurance. So we try to do that legwork to make it a little bit easier for people. And then we get calls about a question I've never had, and then I have to research it. And we have other professional people that we can get in contact with if I need help following up. So it varies, and some people are one shot, and some people come back, and so it really varies. Yeah.
I think this is a really, really powerful thing for us to understand, is that if you yourself, for example, are maybe feeling depressed or anxious, to think about Googling all these different mental health places and calling them, which one has insurance, who has an opening, getting on waiting lists, it's overwhelming. That is the beauty of Mental Health Connect. You call them, you say, I live in Bloomington, I'm feeling a lot of anxiety, I can't sleep, blah, 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 whatever it is. They do all that horrible legwork for you, call you back and say, this place has an opening, they take your insurance, you can see them next week or in 2 weeks. And then Mental Health Connect calls you back and says, how's it going?
Yep.
Yeah.
Yeah. Yep. So
I just want to make a comment.
Yeah.
The other thing that you asked about, if somebody did call with a crisis, they definitely would refer
Oh, of
immediately
course,
to,
of course.
The suicide line or.
Yeah, and that's pretty clear on our website too. They have all that information. Yeah.
Are you guys mandated reporters?
I am not, but my boss is.
Okay.
Yep.
So you do, if there's things that
Yes,
come up.
of course. And
with
I
the
always
reporters.
ask, are you feeling safe in your environment? Is a question. It's-
And the really nice thing about, with our new executive director, she not only is a pastor, Hannah Campbell Gustafson, but she also is a social worker.
Oh, wow.
So it really is very, very helpful in our program. And then does Jan meet with you? Jen
Uh-huh.
Nelson Schwartz, who's
Yep.
from one of our faith communities, Elam in Robbinsdale. And so she kind of gives a lot of input too.
We get a lot of questions about addiction, dual diagnosis, both mental health and could be drug addiction, alcohol. And there's amazing treatment facilities in Minnesota, both in-house and intensive therapy where you get 5 hours a day of therapy, but you're an outpatient. So there are all kinds of levels and there are places where you can go. So I think we do a good job, even though there's some underfunding. And there are wait lists. I mean, that's the reality right now. Sometimes your primary care doctor can get you in faster than just calling. So we also try to involve that part of your insurance and background.
Our navigators are fabulous. I will tell you that I'm very comfortable with the competency of our navigators. They're just amazing. So we have how many now? 6?
We have 5, and then we have interns from Augsburg who are social, into the social services, and they also bring another level because they're on the cutting edge of what's new. They'll do research for us, and we have hundreds of resources we have to keep updating and make sure that we have the latest information. So they're really helpful.
What's your physical, like, are you just Twin Cities or?
Mostly Twin Cities. We Western Wisconsin.
Okay.
And if I get out-of-state calls, then I refer them to NAMI
Okay.
as a starting point. And because every state has a NAMI branch.
Yeah.
Yeah.
We're pretty far out though. We do have the church, like she said, in Wisconsin, Cross Lutheran in Roberts, Wisconsin. And then we have a church, Trinity Lutheran in Lindstrom.
Okay.
So that's pretty far out. And St. Francis United Methodist Church. So we're kind of well beyond just the Twin City area.
Yeah, St. Cloud, Duluth, I get calls from. And some people find us who aren't part of a faith community. Of course, we don't turn anyone away. Anyone who calls gets help,
Yeah.
for sure. Any other questions?
So
or
do you
comments?
know if people here have, and I'm not asking anything confidential, but if people here are familiar with the service, use the service, do you know? If you
I'm not
refer
sure.
people?
I'm not sure. I don't think I've ever really asked.
Okay.
Yeah.
Yeah, it
Put
is
some of those
confidential.
Strips up the.
Yep, that's always a good sign.
Mhm.
We've tried to make the sheets a little bit more private, putting them in the bathrooms where it's not so obvious if you take one, because as we talked about, there's still a stigma that if you take a strip that says Mental Health Connect, we're worried that people might look at us and go, well, what's wrong with that person? Ideally, it would not be a big deal at all, that we would go, oh yeah, we all experience that at some point, and it could be for a friend, it could be for them, doesn't matter. We all need the help.
And sometimes people want a religious component. They want a therapist who has religious training or has a Christian perspective. And so we can find help along those lines too.
Anything else on the navigator service? Because that really is one of the things that really makes us unique, is that navigation service, as you said.
Yes.
I know that taking or that helping people who are struggling with some of these things can have its own toll on you guys. So, how do you guys fare with the stress at the job?
That's an interesting comment. Some people get to me more than others. And right, you become invested, and you don't always hear what the end result is, so that can be frustrating, for sure. But there's a lot of support within the organization. That's what I would say about that. So the self-care, we've had training sessions on self-care, for instance. So that's important.
And I think your weekly meetings help with that too, right?
Oh, yeah.
Because you have each other.
Yep. Yep.
Maybe this is too far in the weeds, but my wife and I have counseling sessions like available through our employers, right?
Mhm.
So, which is a nice benefit on paper, but when we've tried to use that, it's just a total nightmare. And I'm wondering if I'm just like an edge case, or if you found that that's like a good path to go to getting help. I mean, at this point, like my complaints with all that is like run the gamut. Like just to the point where I think like those services are kind of a scam.
Yeah, we do encourage if someone is employed to check to see if there are programs available. And we also try to say if you're seeing a therapist or you're in a program, try to give it 3 sessions before you decide if it's not a match. And it may not be a match, and that's okay for you to seek help elsewhere with somebody else. Yeah. So you kind of have to trust your gut on that, I guess.
So your employer situation, they can't get you the resources you need or to start
Just
responsive?
everything. I mean, again, into the weeds, but it's like, we'll try to get help. They'll say, yeah, we can help, but you know, here are a list of 20 places that are like part of our network, and then you'll have to call and do the legwork to find if it's open, and then do they see kids, and then do they do in person, and like, you have to do all the winnowing down, and by the time you get to it, then like, we've had multiple instances where we find people and they cancel, or like, you know, like in one case, we finally got someone, we were gonna meet them on Monday, they called Friday, they said, oh, we don't take this insurance, and then, like I said, we'll cancel it, and then, like, they're saying, I missed the meeting on Monday that they canceled on Friday, so I get bills.
Yeah.
Oh my God.
I'm like, you guys are all scammers, like, it's just ridiculous.
Wow.
So you can, so that really does speak to
Yeah.
the
So at this point, I've
benefit
like given up, like,
of
I don't.
navigator service.
I don't know.
Sorry you're experiencing that. And the insurance still, there's not a real parity between often what's covered for physical health and mental health, unfortunately. So.
I mean, like, even before, like, we got these employer benefits, we were calling around, like, can we get help? And they're like, well, what's your insurance? And they're like, well, we have insurance, but, you know, there's a wait list if you have, you know, insurance. So we're like, well, we'll pay you cash. And, like, we can just pay whatever rates you have. Like, no, we want insurance. And you're like, what? So, like, there's, you know, nothing out there. Like, really nothing.
And sometimes if you're on Medicare or Medicaid, it's a different system. The wait list is
Yeah.
longer, the reimbursement is less, so the facility may not be as willing to take it.
I'm glad you know about
unfortunately.
Mental Health Connect now because you.
Yeah, I just need to call a navigator, I think, and just
Yeah.
try. I haven't yet, it's been like the 6th thing on my list.
Yeah.
Like, yeah.
Yes, well, please contact us, for sure.
Yes.
I have concern about our young people. Sometimes the parents don't know how to get help. That's my concern with youngness. Anxiety.
Yes, yes.
And
Yes, it's-
sometimes there was an incident not too long ago where the school had called the parents and they didn't know how to handle it. So I'm very concerned about all our young people. There's drugs and things that they have on Facebook or whatever it is.
Right, that is the, as I mentioned, that is the number one concern when we talk
I am
to
concerned about the
faith
young ones,
communities.
yes.
Yeah,
I think from my understanding is Mental Health Connect's vision is starting with congregations and kind of opening up. So families that are part of these congregations, getting more congregations to be part of the network. But as well, like, it isn't just people who are atonement members that I could refer.
right.
If someone from the community came to me, or someone from one of our renting communities came to me, I could refer them to Mental
Yes.
Health Connect.
Yeah, because we
Um,
consider them part of your community if they come to you.
Exactly. So that's sort of where Mental Health Connect is starting with communities, trying to get more communities involved, and in that way, the families that are involved in that who have kids, that it kind of spreads that way in terms of knowing about Mental Health Connect.
Yep, absolutely. So do any other questions on navigation? Because like I said, that is our main uniqueness. That's what makes us really unique. There's nothing like it.
I I had one, I guess.
Yes,
So I assume it's free for the people that call.
yes,
Okay.
yeah.
Free and confidential, of course. If you don't want to give your name, if you don't want to give your email because someone else might be reading it, there are all kinds of safeguards for people, yeah.
And one of the reasons why it's free is because member congregations will give some sort of yearly donation, you might call it, or
Right.
dues, or whatever it is.
Investment, we call it.
Investment, I love it.
Investing in your own community and in Mental Health Connect.
Absolutely. So that is something that if you were ever feeling passionate about, you could just write a check and in the memo put Mental Health Connect. And we would funnel that money right to Mental Health Connect.
And the speaking of that, the fees that we get from the faith communities does not cover our expenses. So we have a fundraiser coming up. If any of you are interested in going, it's incoming. It's a breakfast on May 9th, and I know you have the information, and some of you are coming. So we do have to do fundraising in addition to what the faith communities give us.
And it's a wonderful breakfast.
It is.
A nice hour of a good program. I was very impressed last year when we went. So you still have a few spots open?
Mhm. We have
Okay.
no tables open, but tickets open.
Okay. So if any of you were interested in coming, it's 8 to 9 a.m. Thursday, May 9th. I'm going, Matt and Christy are going. So if you were interested in coming, you could probably talk to one of us. And there's, I think it's $25
Right, $25
for
ticket.
a really good breakfast and program.
And we have really good speakers, one of which is your pastor. So that should be a motivation in and of itself.
Because they don't hear enough of me.
She only has 5 minutes though. so-
Yeah.
We have a stage manager that'll sit there and. So I think it's also worth mentioning the ambassadors, which are critical. We could not do Mental Health Connect without ambassadors. So every faith community has 2, 3, 4 ambassadors that are the liaisons between the faith community and Mental Health Connect. So there's a chart here that it just really describes the role of Mental Health Connect and the role of the faith organization. And those ambassadors are the liaisons, so they give us information on what the faith community needs and then communicates to the faith community what is going on with Mental Health Connect and what we can do. So I don't know if either of you want to talk about your role as ambassadors?
Okay, so I have been to the breakfast before,
Uh-huh.
and so I attend the meetings. Not every one, but I've attended a number of them, and yeah, they're very topical. I mean, a lot of them deal with children, and probably the second most important topic is probably people starting with some sort of drug abuse or something.
Yep.
And yeah, I mean they're usually they occasionally have breakout sessions, but they're generally more kind of informative and have questions that they have. Like you can ask questions and things. So, yeah, they were generally pretty helpful, very helpful.
Good, I'm glad.
Thing.
And then do you communicate back to your faith community, kind of what's going on, or?
Yeah, I mean, Chrissy does a lot of the handouts and things.
Okay.
And then we communicate. Yeah.
Yeah, we really appreciate you, both of you. Thank you.
Thank you.
Any comments?
Yeah, Tuesday nights are hard for me, so I usually watch the meetings later online. But yeah, I just consider myself more of like a resource. So if anybody ever needed anything, you know, our names are in the newsletter. They can come to us, and we'll help them in any way we can.
Yeah, that's also really helpful in the faith communities to have someone besides the pastor that someone can go to and just say, well, should I call the navigation line, or will you help me call the navigation line? Make it easier for me. So it's really good to have that resource within the faith community also. So thank you both of you.
And my guess is it's better when in doubt to call the navigation line if you're not sure than to not call the navigation line. Because you could always say, oh, well, I'm going to refer you somewhere else. This isn't our purview, but
Yeah.
better that than the other way where you could really use the help and don't get it.
Yeah, you can text. You can text and email.
Text,
and,
email,
yeah, you
and
don't even
call,
have to speak.
whatever you're most comfortable with.
So how are we doing on time?
Got about 5 more minutes.
Okay, so the next chart, one of the other trainings that we do, I do with Dennis, is how to develop your mental health ministry. And one of the things that happens many times is faith communities will say, well, you know, we're not doing much. And so we'll say, let's just take this charge, and we won't have time to do it, but say, what are you doing related to mental health? And pretty soon they realize choir is part of mental health. A book club is part of mental health. So there are a lot of things, youth groups and different things that really relate to mental health, but you don't call it that. So you don't kind of collapse those into categories. So letting faith communities know, yeah, you could probably be doing more, but you're also doing a lot. In my opinion, mental health is the thread that runs through all outreach programs. Whether it's homelessness, environment, any of the things that we're doing, mental health is a part of it. So I'm going to skip that, but if you ever want to just sit as a group and say, what are we doing related to mental health, I think you'll be amazed at the amount of things that you have. And the last is just the benefits of being part of Mental Health Connect, and I think we've kind of pretty much covered those. So any other questions or comments at all?
Does Bloomington have a walk-in emergency clinic for health issues like
Is there one in
that?
Bloomington?
I'm not sure. I would have to check my resource list. Minneapolis has one called the Front Door. So I'm not sure, but most of the city websites have incredible resources listed under mental health. So that's probably where I would go to research your question, but I don't know offhand.
And is the state cutting back again on funding or not?
Well, there's something about a law that's going to go sunset, that's going to go into effect in 2025 unless they do something now. So it's kind of up in the air.
Kind of buffer that cutback.
Yeah.
But you could call Mental Health Connect tomorrow, and you could say, is there a walk-in clinic in Bloomington, and they'll find out for you.
I see.
For sure.
You can call today and leave a message even.
I was going to ask Siri, do you get many walk-ins off the street needing help?
They don't ask for mental health help. We have people who will call that usually want financial resources, and for that we give gas cards and so on and so forth. And you're just making me think about this, that oftentimes people who have financial issues, that they need financial help, have mental health issues because that's so stressful.
Right.
It's so stressful to not have your basic needs, like sure where that's going to come from. And so I just thought about that fact that while I talk to them about what resources are available, like Veep, I do a lot of referring to Veep, that I could also say if you're feeling like you need other help. Though many of them do struggle with finances, and so that can be difficult if they don't have insurance. But yeah, it's always a possibility. It's a good.
Yeah, and Judy and I have both worked with homelessness a lot, and really found that if you don't have mental health issues when you become homeless, you have mental health issues from being homeless.
Yes.
So that financial piece, that poverty piece is really critical. Anything else? Thank you for having us.
Yes,
It's
thank
it's
you.
really nice.
Thank you.